Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin and Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made in shaping and strengthening this community, our province, and the country. On this, the second National Kids and Vaccines Day, we're delighted to speak with Dr. Shannon McDonald, Megan McDonald, Pamela Nagy, and our Q&A moderator, Dr. Katie Burney, to bring you Improving Vaccine Uptake, Prioritizing Pain and Fear Management During the Immunization Experience. Before we begin, we invite you to answer a few quick poll questions for us. Please note you'll have to answer all three questions to submit your response. While you are entering your questions and Jose launches the poll, I want to thank you so much for participating. And I'll introduce our speakers for today. Dr. Shannon McDonald is an associate professor in the Faculty of Nursing and an adjunct professor in the School of Public Health at the University of Alberta and the Department of Pediatrics at the University of Calgary. Her clinical background is in pediatric nursing, with research training in nursing, public health, and epidemiology. Her research focuses on supporting immunization best practices and policies, and she has a particular interest in addressing system-level barriers and supports to achieving high immunization coverage in underserved communities. She leads an interdisciplinary research team that works with vaccine policy advisors, program administrators, and clinicians to address real-world questions to inform immunization best practice and policy. Megan McDonald is an operations manager with public health in Edmonton, Alberta. She completed a Master's of Business Administration at the University of Fredericton and a Bachelor of Science in Nursing with distinction at the University of Alberta. After working as a registered nurse in labor and delivery for 6 years, Megan transitioned to a formal leadership role, working as a unit manager in pediatrics for 3 years. She's been in her current role since 2019 and is passionate about removing barriers to access in healthcare settings and creating inclusive environments that meet the needs of all children, especially those who are neurodiverse. Pamela Nagy is the registered nurse with public health in Edmonton, Alberta. She completed a Bachelor of Science in Nursing through the University of Alberta in 2005. And the first 10 years of her career were spent at the Stollery Children's Hospital working in pediatric cardiology and intensive care. Pam has been in her current role for 13 years. Through her work as a registered nurse and her own lived experiences with a medically complex child, Pam developed a passion for helping children undergoing painful procedures. And she's an advocate for creating positive experiences for those struggling with needle fear, phobia, and anxiety related to medical procedures. And Dr. Katie Burney is a clinical psychologist and assistant professor in the Department of Anesthesiology, Perioperative and Pain Medicine, and Community Health Sciences at the University of Calgary, where she leads the Partnering for Pain research program. She's also the Associate Scientific Director of Solutions for Kids in Pain, or SKIP, a national knowledge mobilization network working to improve evidence-based children's pain management through coordination and collaboration. Dr. Burney joined Alberta Children's Hospitals as a medical psychologist in 2018, where she continues to provide clinical care through the Vi-Riddell Children's Pain and Rehabilitation Program. During this presentation, we welcome you to converse in the chat box and type your questions in the question and answer box, which we'll pose to our speakers at the end of the webinar. And it's now my pleasure to pass the mic to Katie.
Hi, everybody. It's a thrill to be able to join you on National Kids and Vaccine Day. And just on behalf of SKIP, I just want to thank Pam, Megan, and Shannon for joining us today too. And we have actually a really good Edmonton representation as part of their work today to share with you. Paula briefly mentioned SKIP. I'm going to share just a couple of resources that are on SKIP's website, which is kidsinpain.ca, or following us on social at Kids in Pain, to learn and share a whole bunch of resources about the evidence-based solutions for pain management, particularly for vaccines, but also other types of painful procedures and chronic painful disease for kids. And we've been very engaged over the course of the pandemic in a variety of different activities to share some of these evidence-based practices, many of which you can find as resources on our website or linked throughout social. And then just in particular, I wanted to draw your attention to a report that we did in partnership with the Immunizing Children with Confidence project with Children's Healthcare Canada. This was published just at the end of 2022, which was a rapid review looking at supporting vaccine uptake in children and youth with medical vulnerabilities. So those youth that have been particularly disadvantaged over the course of the pandemic. And some of this relates to pain management, but also a variety of different strategies, particularly for health professionals or health systems leaders and organizations to consider in terms of supporting this population. So with that, and no further ado, I'll turn it to Dr. Shannon McDonald.
All right, well, thanks for having me today. As was mentioned, a number of us are based in Edmonton, so I just wanted to acknowledge that here in Edmonton, we sit on Treaty 6 territory and Métis Region 4, where we're enjoying a beautiful sunny -25 winter day. So I'm going to kick things off by sort of setting the context for the importance of increasing our vaccine coverage rates. So I'm going to be talking about the recovery of vaccine coverage as a result of the COVID-19 pandemic, and particularly talk about what coverage rates have looked like and then the barriers to vaccine uptake going forward. So early in the pandemic, there were a number of studies done that looked at what coverage looked like in high-income countries, which is what I'll focus on. So in the United Kingdom, in late March and early April of the beginning of the pandemic, the number of doses of measles, mumps, rubella vaccine had dropped almost 20% below the same period in 2019. In the US, we saw even more substantial drops reported. So in March 2020, again, right as the pandemic was kicking off, the number of measles containing vaccine doses delivered dropped by 50%. And we have also data from Canada, in which in May to July of 2020, about 45% of Ontario physicians indicated that there was a negative impact on immunization services. So in Ontario, they use a lot of physician delivery of vaccines, and with clinics being closed and whatnot, coverage really dropped substantially. So looking a little closer to home, this is work that my team has done in Alberta, where we also found similar drops in coverage. So this graph, I'll orient you to this a little bit. This graph shows coverage for measles, mumps, rubella vaccine at 1 month past the due date, which is at 12 months of age for the first dose. And what we did is we looked at the percentage of kids vaccinated in 2020, so the first pandemic year, and subtracted the percent of kids vaccinated in 2019, the year before the pandemic. So the line, when the line is in the green region, it tells us that vaccine coverage was higher in 2020. And when the line is in the red region, it tells us that the vaccine coverage was lower than in 2020. So if you follow that line across, you can clearly see that coverage fell with the onset of COVID-19 lockdowns in March of 2020, as indicated by the arrow there. Coverage levels were about 10% lower for this particular vaccine than they were at the same time the year before. Coverage came up to near normal levels in May or June as public health centers really figured out their processes for still getting kids in to get vaccinated. But then we started to see a drop again in October, November of 2020, and this is when COVID cases were starting to rise. People were being encouraged to reduce social contacts again, etc. This graph only contains data up to the end of that first year of 2020, but anecdotally, we've heard that there were some continued drops after that, and that coverage rates have fluctuated below the level that we had pre-pandemic. Then turning to school-based vaccines, we actually noticed even much more significant drops among school-age children. The proportion of children who received all their scheduled doses of HPV vaccine was significantly lower in that first year of the pandemic. So this is the school year of 2019 to 2020 as compared to the before the pandemic. And the reason why there's a gap, there's no 2018-2019 bar there, is because there wasn't a school-based program that year as we transitioned to delivering vaccines in a different grade. You'll see we didn't get much of an improvement the following year. So this was the second school year of the pandemic, where coverage for complete coverage for HPV vaccine sat at about 6.6%. So this is pretty substantial drops. So then we wanted to see, okay, how are we doing in terms of recovery? Because public health was figuring out processes to get into schools and whatnot. So on the right side here, you see a graph that shows coverage on the y-axis and the dates along the bottom. And you can see we looked at the group of kids that started at 5.6%, that's the 2019-2020 school year, followed them over more than a year, and coverage got up to about 50.2%. Just to remind you, the pre-pandemic year, we were at 66.4%. And just to remind us all what our target level actually is for this vaccine, it's more like 90%. And again, this data ends in 2021. So we need to do a little more work to find out what recovery has been like, but we know it's not back to where it needs to be. And part of what is informing that is that we're starting to see the impact of low vaccine coverage, not just in Alberta, but elsewhere. Now, not all of this is related to the pandemic, but it does highlight that when vaccine coverage levels drop, and particularly when there's clustering of low coverage in certain areas, that you see outbreaks of disease. So we recently had a whooping cough outbreak in southern Alberta. There's been measles outbreaks in various places in the world. Meningococcal disease, which is a disease we really don't want to see. Diphtheria, in fact, one that's has become really uncommon, has been rearing its head again. Polio, which it largely has been eradicated from most parts of the world. All of those have been rising again. So there's many reasons why a parent may not get their child vaccinated, and I'm sure there's lots of folks on the call here today who encounter these parents all the time. And we often think of the reasons related to lack of trust in vaccines or in healthcare, and about parents being misinformed or disinformed about the safety and importance of vaccines. But there are also a number of factors about the way we deliver vaccines that can make getting vaccines more difficult. So for instance, in many cases, parents aren't even sure when their child is due for a vaccine. So the complex schedule, which changes periodically, can be a challenge. It can be difficult to make an appointment that accommodates a working parent's schedule. It can be difficult getting to a clinic if you are dependent on a bus or don't have access to transportation. There can be challenges if appointments and information about vaccines are offered in languages that are not comfortable to the client. And what we're going to learn about a bit more today is about some of the other factors that can act as barriers, which include anxiety-inducing environments and fear about the pain associated with vaccination. What's unique about this barrier is that frontline providers can do something about it. This isn't something that requires societal change or infrastructure change. This is a factor that healthcare providers can really make an impact with. So how big a problem is it? So a very recent systematic review by Anna Taddeo and team found that pain and anxiety are responsible for 8% of the general population, stating that that's the reason why they didn't get vaccinated. And that number rises when you look at the population of under-vaccinated people. And in that group, more than 18% of them said that that is the reason they didn't get vaccinated. So as we'll learn from the other speakers, this is especially important to consider for children who have multiple health challenges. So just summing up, doing everything we can to facilitate high vaccine uptake is always important. The pandemic caused significant drops in routine vaccine coverage among both infants and school-age children. Even though things like lockdowns ended over a year ago, coverage remains below pre-pandemic levels. Appropriately managing pain and anxiety associated with vaccination can really have a significant impact on vaccination rates and can be a crucial part of recovering from the pandemic. And I'll end there and turn it over to my colleague.
Wonderful. Thank you so much, Shannon, and really striking some of the pieces that you're presenting in terms of change. So I think we're going to turn it over to Pam at this stage to share.
Okay, so thank you so much for having me today. It really means a lot for me to be able to share our story as a family. So every time I do it, it helps a little bit on my own healing journey. So I really love to come and speak. So thanks for having me. I'm here to speak to you about the impact negative pain experiences can have on the development of needle fears and phobias, and how compounded positive experiences can build resiliency and repair trust between healthcare providers and patients. Throughout the presentation, I'm going to speak to you as a mom, but also as a nurse who gives immunization almost every day. So these are my kids, Gavin and Morgan, and this is a little bit about our story. So Gavin became very ill at the age of 2, and we had a very long journey of about 8 years to a diagnosis of autoimmune encephalitis. Treatment was another 4 years, and complications really seemed to come in every form. Both of my kids were affected in different ways. Gavin injured PICC lines, blood product transfusions, plasmapheresis, central lines, way too many IVs to count, and he had these invisible veins that always resulted in multiple pokes, and his IVs often ended up in his feet. In this picture here, you can see Morgan, his sister, at his bedside, and this is where you would find her during every admission. She was a witness to every struggle, and it really affected her very deeply, but she refused to leave his side. So it's not hard to see here where our needle phobia developed. Throughout our experience, we had a pediatrician who really advocated to make our journey the best it could be. But unfortunately, it's those repeated negative experiences that really affect our kids the most. Numerous times, we thought we had gotten to a point where we were making progress. And then we would have a negative experience, and it really just put us all back at the very beginning, and it was infuriating for our family. These repeated negative experiences eventually led to an avoidance of routine medical appointments for things such as immunization. As a mom, I didn't know what to do. I felt lost and misunderstood and exhausted, and I was incredibly angry. And I felt like I was failing. I'm a public health nurse, and I couldn't even take my own kids for their vaccines. At some point, these thoughts and feelings started to trickle into my own nursing practice, and I kept thinking, is there something I can do to ensure that no one under my care ever felt the things that I was feeling as a mom? I began asking my patients questions that I wish people had asked me in my family. And the first one is always, how can I make this experience easier for you? I also started to assume that every person walking into my clinic room had experienced some form of trauma in their life. We really have no idea who our next patient is going to be and the reason for their behaviors during an appointment. So in 2020, COVID hit, and like many other parents, I was left wondering how the heck I was going to get my kids through the door for their immunizations. We couldn't play this avoidance game any longer. I was lucky enough in my role to know that low stim clinics were being developed. And once they opened, I was able to attend with both of my kids. The focus of low stim clinics is really on using choice, collaboration, and control to guide families through the immunization experience. And I'll give you some examples of how those were used during our appointment. So choice really involves asking the questions, where do you want to sit? Would you like the lights dimmed? What arm would you like to use? Is there a comfort item you brought? And can you tell me if there's anything I can do to make this easier for you? Collaboration for us involves speaking to a nurse prior to the appointment and having our needs really well documented. I was able to request that the vaccines be drawn up prior to us entering the room. And I had mentioned that a major trigger for Gavin was having the door closed. A shut door to him meant something really bad was about to happen. And when we walked into that clinic room and the door was left open, I can't even explain to you the relief that I felt. And control, getting the vaccine, it's a non-negotiable, but there are so many things that we can do to allow kids to feel in control of their environment. For my kids, it was lights dim, door open, vaccines ready. And we had a nurse who showed kindness and compassion to our situation, and my kids could really feel that. And this is a result of our low stim appointment. It was incredibly successful for us, as you can see. But it's also important to note that sometimes the vaccine doesn't get done that day. And it's really important to know when to call it. We always focus on what was done well during the appointment and what steps we can take next time to make it even better. In low stim, we have so many repeated appointments. And sometimes the first one is just meeting the family in the parking lot. The next may be entering the building. And the next could be entering the clinic room and actually sitting in the chair. And all these steps are, they're small to us, but they're major milestones for these kids and they deserve to be celebrated. So this is the perfect example of how compounded positive experiences can build over time. So several positive experiences allowed my kids to reestablish trust with healthcare providers, and they were able to receive their school vaccines in a school setting and not in a specialized clinic. On the far right here, you can see my daughter Morgan. This was just 3 weeks ago, getting her grade 9 vaccines at school, and that was a major win for us. So as I said before, we really don't know who our next patient is going to be. This is Gavin now. He's 16 and Morgan is 14. And 3.5 years ago, this was my son. And sorry, I knew this was going to happen. This was my son just 3.5 years ago. And if you were to walk into your clinic room today as this young man, you wouldn't have any idea, what he's been through, how his journey has affected him to this day. And it's important for all of us to know that about everybody we've seen. And if I can leave you with one thing today, it's that the positive experiences we give don't take extra time or bells and whistles or money or anything. They really just simply take kindness and compassion and truly understanding the needs of the families in front of us. Thanks.
Thank you so much, Pam, for sharing that. I'm looking forward to the Q&A. I can relate to some of your comments of being an expert in this area, me as a psychologist, you as a public health nurse, and how it actually impacts our kids who have needle fears. And thank you just for sharing. Megan, I'm going to turn it to you. I know you're speaking a little bit more about what is this low stimulation clinic that Pam spoke so highly of, and how it's really was critical for her family.
Absolutely. Thank you so much for inviting me to be a part of the webinar today. It's a pleasure to be here and to present on the low stim clinics that have been established in the Edmonton zone. Today's presentation will provide an introduction on what a low stim clinic is and how we set it up, the results of the low stim clinic for the patients and the families who have accessed our services, a discussion of what we've learned and the improvement that we've made over the past 2 years, and then what the future holds for our low stim clinic. So children with disabilities are at an increased risk of severe illness, making vaccine administration for this population vital. However, accessing traditional immunization clinics may present barriers such as long queues, lack of private space, and noisy clinic environments. Easing physical, sensory, and cognitive barriers to the implementation of modifications at vaccine sites can help to improve the immunization experience and increase uptake of childhood vaccination. Mass vaccination campaigns by design focus on efficiency and immunizing a large quantity of people in the smallest amount of time possible. Although these campaigns are tremendously successful, the design of these vaccination spaces may not be ideal for individuals with specific sensory needs. In the spring of 2021, Alberta Health Services, AHS, recognized the need for these alternate clinic environments to improve the uptake of COVID-19 vaccines. The purpose was to provide a clinical space with a quieter, less stimulating environment for individuals with behavioral or specific needs who had not been successful in receiving their COVID-19 vaccine in a traditional clinic setting. Our low-stim clinic was opened in Spruce Grove, Alberta, 11 kilometers west of the city of Edmonton in April 2021. Any individual residing in Alberta could self-refer to the clinic. There were no inclusion or exclusion criteria put in place to reduce barriers to timely access of COVID-19 vaccines. When the clinic first opened in April 2021, Pfizer and Moderna COVID-19 vaccines were only offered to Albertans over the age of 18 years. As such, the primary population seen in the clinic at this time were adults with physical or cognitive disabilities and needle phobias. With the approval of Pfizer COVID-19 vaccine for children between the ages of 12 to 18 years in May 2021, and subsequently children 5 to 11 years in January 2022, the low-stim clinic began seeing pediatric patients with diverse needs, including autism spectrum disorder, needle phobias, and complex medical conditions. The delivery of influenza vaccine was then added as an option through the low-stim clinic in October 2021. Communications about the opening of the low-stim clinic was shared via social media platforms by AHS Communications and through various local news outlets. It was also shared by a variety of local organizations and social media parent groups. When patients or family members self-referred to a low-stim clinic, a standardized referral form was completed by a member of the administrative team and forwarded to an intake nurse. An intake nurse would then call the family to discuss their individual needs, their history, their eligibility for the vaccine, and develop a comfort plan using commitment to comfort strategies and resources, as well as a trauma-informed approach. For those of you who are not familiar with Commitment to Comfort, it is a provincial program designed to reduce pain and distress and includes strategies that can be used to improve the immunization experience. For example, the use of numbing creams, distraction techniques, and the use of positive language. Based on the intake conversation and the needs of the patient, the individual was booked into either a clinic appointment or accommodations were made to immunize them in their vehicle. A little bit about the clinic space. Appointments were staggered to reduce the number of individuals in the clinic, and appointments were set at a typical length of 20 minutes, with longer appointments available based on the intake assessment. Over time, the booking process was refined to include a follow-up email to the family with specific details and photographs of the low-stim clinic. The family could use this information to develop social stories and prepare individuals for what to expect at the time of their appointment. The physical clinic space was adjusted to reduce sensory input. Lights were dimmed or off in some spaces, and patients were immediately moved into a private clinic room following registration. Clinic doors could be left open or closed based on the individual's needs. Patients and guardians were encouraged to bring distraction and comfort items. The immunizing nurse reviewed the comfort plan with the individual and their caregiver at the time of the appointment. Post-immunization, nursing staff reviewed the appointment with the patient and family, focusing on what strategies worked well to build capacity for future immunization events. Praise and positive reinforcement were also provided to improve the patient's experience. Patients who were unable to receive their vaccines at their initial appointment were offered future appointments and additional coping and comfort strategies. Sometimes entering the clinical space presented a barrier for patients, such as those who were unable to position themselves safely during the immunization and for those who could not continuously mask. The required supplies were then wheeled out to the vehicle using a mobile cart. Support people were instructed to have the patient sit in the back seat of the vehicle with their seatbelt fastened and sit next to the patient to provide a comfort hold if required. The immunizing nurse would then open the vehicle door or window and complete the immunization. Individuals and families were instructed to remain in the parking lot for 15 minutes post-immunization and were provided with the clinic number to call in case of an adverse reaction. Between April 2021 and May 2022, the Low Stim Clinic in Spruce Grove saw 712 patients and caregivers. Of those referrals, 185 patients were 18 years or older. Most patients accessing clinical services, 74%, were children under the age of 18 years. Interestingly, more males than females accessed the Low Stim Clinic, and patients were geographically dispersed across the Edmonton zone and rural Alberta. The most reported reason for a referral to the clinic was autism spectrum disorder at 32%, followed by needle fearophobia, 27%, and anxiety disorder, 18%. Caregivers or siblings were immunized at the same appointment as the primary patient to reduce barriers to access for the family unit 6% of the time. The immunization success rate for the clinic was 90%. Patient and family feedback was obtained through informal sources such as social media posts, emails to immunizing nurses, calls to the operations manager, and through AHS communications. Choice, collaboration, and control were the three primary themes that were identified. Patience, kindness, longer appointments, and an understanding of the patient's history also had a positive impact on the overall patient experience. Caregivers appreciated the comprehensive preparation that happened prior to the clinic appointment, for example, developing a care plan, emailing with clinic details and pictures, and links to additional resources. Reduced wait times prior to the clinic appointment, decreased visual and auditory stimuli, and the availability of private clinic rooms were also identified as key elements in creating a welcoming clinic environment. The option to immunize in the vehicle was seen as valuable for many patients who were unable to safely be immunized otherwise. The use of positive language, building rapport with the family through common interests and humor, and respecting the wishes of the patients and their families also contributed to a positive experience. The success of the clinic led to the expansion of the initiative to include 5 additional sites in the Edmonton zone and increased service delivery from COVID-19 vaccines and annual influenza vaccines to include all provincially funded vaccines, including school-aged immunization. Smaller scale low stimulus vaccine sites have been opened in Yellowknife, London, and Regina. To our knowledge, these clinics were temporary in nature, focusing strictly on the delivery of COVID-19 vaccinations and did not expand beyond this initial mandate. Our clinic has demonstrated a need for continued access to low stim clinics for all available vaccines. Instead of decommissioning at the end of the COVID-19 campaign, the Low Stim Clinic has expanded, opening more clinics in the Edmonton zone and offering additional vaccines by securing permanent public health funding. In the Low Stimulus Clinic's first year, we identified staff understanding of neurodiversity as a gap in learning. Long-held stereotypes, for example, that individuals with autism could be more physically aggressive than their neurotypical peers, led to misperceptions that staff did not have the training or education to safely immunize these individuals. As a result, an education initiative regarding neurodiversity, addressing individual biases, an explanation of sensory overload, and strategies that could be used to support individuals who are experiencing sensory dysregulation was provided to immunizers. To improve communication between nursing staff working in the Low Stim Clinic, intake nurses were asked to document the patient's comfort plan in the electronic medical record following the intake conversation with the individual and/or their caregiver. Immunizing nurses could then update the documentation to include which strategies were effective or ineffective following the immunization appointment. This information was then available to all public health nurses across the Edmonton zone and could be used to inform comfort plans for future immunization appointments. Our Low Stim Clinic found novel benefits to in-vehicle immunization, specifically reduced barriers to access when patients were unable to enter the clinical space. Despite the overwhelming success of this approach, inclement weather provided a challenge for immunizing in the vehicle, particularly during the winter months. Ice on the ground, as well as frigid temperatures, pose safety challenges for the nursing staff and vaccine integrity. To overcome these barriers, patients and families were asked to park in the loading dock, which provided additional shelter from the elements. In addition, when the temperature fell below -15 degrees Celsius, patients requesting in-vehicle vaccinations were offered the choice to try immunizing in the clinic room or to rebook their appointment at a later date. When the clinic was first opened, some nursing staff reported a feeling of failure if they were unable to successfully complete the patient's vaccination at their first appointment. Coaching was offered to the nurses to shift the definition of success from completing the immunization to partnering with the patient, focusing on capacity building over time. Nurses also reported that even minor modifications to the clinic space, for example, removing or covering medical supplies, had a tremendous impact on the patient's experience. Based on current literature reviews, there's a gap in quality improvement initiatives and research studies to determine the long-term impacts of alternate vaccine delivery models in improving vaccine uptake and decreasing pain associated with immunizations for patients with neurodiversity. The use of low-stim clinic for vaccination has been a successful quality improvement initiative. The clinic is an inclusive environment that meets individuals where they are at and builds capacity in their coping skills. Positive healthcare interactions such as these foster therapeutic relationships with the health system and increase immunization rates in populations that have historically been unable to receive their vaccines in traditional clinic settings. We learn that seemingly small adaptations can have profound impacts. There is an opportunity to introduce low-stim clinics in communities across the country to provide improved access and client-centered care to individuals with diverse needs. Maya Angelou said, "Do the best you can until you know better. Then when you know better, do better." The implementation of low-stim clinic doesn't take a big budget or state-of-the-art infrastructure. All it takes is curiosity, kindness, and a desire to do better. This clinic would not have been possible without the unwavering support of AHS's public health leadership team, who saw the potential in creating the unique space and gave us the autonomy to get creative and get curious to meet the needs of our patients. I would also like to thank the exceptional team of nurses and admin staff that work in the low-stim clinic who were brave enough to try something new and to think outside the box. Specifically, our educator, Shauna Gallagher, whose passion for this work is infectious. Finally, I'd like to thank Dr. Samina Ali and Dr. Elise Kammerer for continuing to share their expertise in reducing pediatric pain through the incredible work that they do with SCIP. They have been instrumental in knowledge dissemination and in supporting the publication of this great work. That's it. Thank you.
Amazing. Thank you so much, Megan, for sharing in more detail about the low stimulation clinic. So yeah, thanks Shannon for joining. Pam and Megan, please feel free to come back on. And to those who are listening, please feel free to put in any questions that you've got. I've got some. Well, we see, and you may have some for each other as well. Pam, I just wanted to start with you and say thank you again for sharing your experience. I think every experience we hear about from families who've experienced trauma from repeated medical procedures, as you've talked about, and had a consequence for that, I think is always powerful and important. But particularly as you were talking, the poignancy of being a public health nurse yourself. And, you know, I was relating to some of that. I have a child with needle fears as well. And, you know, how much, you know, and I'm a psychologist who treats needle fears, right? In kids. So, and that I just appreciated your honesty and saying, you know, like, and yet it was still hard for us to go out. And sometimes we avoided it because, you know, I've experienced that as well as a parent, while it's still being kind of a non-negotiable. And it just struck me and, you know, your role and Shannon and Megan just reflecting on this as well, you know, the power of health professionals in the system, right? That we can even amongst parents who also possess, you know, some of that expertise and that ability to advocate within the health system, still struggle, you know, with some of this. And I think really speaks to the power differentials, whether it's in a school-based immunization clinic, at a mass immunization clinic, in your family physician's office, you know, or at a low stimulation clinic. I just wondered if we'd like to hear each of your thoughts about that. And maybe Pam, start with you. You know, how we want, you know, so much to partner and work with youth and families in supportive ways to support kids to have positive vaccine experiences. But there's such a power differential within our health system. What are your thoughts, Pam, on how do we tackle that? How do we, you know, not have that someone like, you know, a public health nurse like you doesn't have to go through kind of that personal challenge and experience, you know, to shift your own practice as well, right?
Yeah, I mean, the biggest thing for me has been spreading the message and sharing knowledge. You know, we started at our clinic, we started what we call PI program, which is positive immunization experience. And that really started the conversation amongst healthcare centers. I was able to, well, with my team, I was able to roll out PI to the Edmonton zone. And I think that did make a big difference with the visits people have with us in public health. But it's so important across the board to be able to have positive experiences. You know, my kids are doing well now, but I'm very aware that it would take one negative experience at this point to really send us flying right back. And I mean, as a parent, you get super tired of advocating all of the time. But unfortunately, that's our role, and that's what we have to do. So as a parent, as a public health nurse, it's education, it's spreading the message, it's doing these kind of talks as much as humanly possible. I would stand on the side of the road and do this if I could, just to make sure people understood how easy it is and how powerful it is. Just simple things.
Yeah, I would piggyback onto that, Katie. I think if you see our clinicians, I mean, we have got just a phenomenal team of public health nurses, but the thing that they do really beautifully is that when that client enters the room, they're looking to come at it from connection. And so they will, like, you'll watch them just kind of grasp onto anything, and it could be Elsa on the shirt, or it could be sparkly shoes, or, you know, something that they're carrying, and they'll find a way to, you know, make that connection with that patient so that they start to instantly get comfortable. And then the question for mom and dad, depending on the age of the child, or for, you know, the kiddo when they're a little bit older and able to advocate for themselves, is, you know, tell me what I can do to make this easier for you today. What, you know, let's partner, let's collaborate, right? And so it's a doing with rather than doing for. And although we have clear boundaries on what we can and can't do, we're not going to hold this child down. That's not part of our role, but it's that curiosity. And so I think as a clinician, every time that patient comes in, like Pam says, you don't know what their story is. And so it's getting curious and it's asking, what can I do to make this easier for you today? And even for our kiddos who don't have a medical history of trauma or aren't neurodiverse, they're neurotypical, even for those parents, you put them at ease, because it's stressful. If you're a new mama and you're bringing your baby in, that's the stressful experience. So to put mom at ease and give her some power, or dad, whoever's bringing them in, to make some choice. What do I want to do to help my child through this really difficult experience? Then we build capacity over time. So the next time they come in, it's a little easier. And as that child gets older, they start to be able to advocate for themselves. And just as Pam said, that choice, that collaboration, the control, if we approach it like that every time as a clinician, I think we're going to start to shift the dial on what those appointments look like for families.
Yeah, one other thing I was going to say is I found it extremely important to give my very first patient of the day the same experience that I gave my very last patient of the day. It's so important that every single child, because, you know, if you get tired at 2 p.m. like we all do, that next patient still deserves your best care. And it's so important because that could be the one that has the trauma and you don't know. I was going to say something else, but it's gone. So I'll think about it.
I see, Shannon. No, thanks, Pam. And I think what I love that you're both talking about, which I've reflected on too, is what's the impact and experience for the immunizer, right? So it's both. Like, we're also talking about what is that for the child and the family, and that's critically important that you're all talking about. But also, you know, Pam, you're just talking about it, like an immunizer. It's humanizing kind of the context, you know, for everybody. Shannon, what would you add? And
Yeah. So the thing that really struck me is when Megan and Pam talk about using curiosity as part of your practice, because where I've seen a lot of challenges is when providers make assumptions. So they make assumptions about why somebody is a certain way. And this has reared its head a lot with COVID, where we see somebody who's not vaccinated, and, you know, the public rhetoric is, well, they're anti-vaccine or they're vaccine hesitant. And there's just that assumption immediately that, you know, they're opposed to vaccines. And you know, as our team has done a lot of research in this area, and we've dug into that a lot. And largely, like, the number of people who are actually anti-vaccine are less than 5% of the population, right? the bigger group that's not vaccinated are the ones that are facing barriers in access. And that could be barriers around pain and anxiety, or it could be barriers about just getting to an appointment. It can be barriers about remembering an appointment. And, if I take myself as an example, I'm educated, I'm motivated, I see the value in vaccines, but for the life of me, I can't remember when my kids are due for their COVID boosters because, we all got prioritized at different times. My husband and I got vaccinated, and then we waited for my 15-year-old to be eligible, and then she got vaccinated, and then we waited for my 11-year-old to become eligible, and then she got vaccinated, and then everybody became eligible for boosters at different times. So if someone like me is struggling with like, how the heck do I keep track of this? And then somebody makes the assumption that, oh, she didn't get her vaccine because she's vaccine hesitant. Like, you've closed the conversation. Like, I don't even want to talk to you about it. So we're doing that to people when we make assumptions. So I love that idea of a curiosity-driven healthcare provider.
Curiosity and compassion. Those are good, really good takeaways, I think, from today's conversation too. There's a question that came into the chat. Do you have suggestions on how do you partner with school-based immunization clinics to integrate some of the principles of the low stimulation clinic into immunization delivery at school? Like, I thought, Pam, you celebrated that success for your daughter, right? And as a psychologist who's treated needle fears, I imagine all of the steps that it took to get to that point. Yeah. My daughter in grade 4 is already talking about what happens in grade 6, Mom. Like, it's
started
amazing.
in kindergarten.
So how do we take that? I mean, Megan, it's amazing to hear about these low stimulation clinic strategies. We often talk about how simple and low cost these are. Like, how do we take some of this into the school-based environment? Like, Megan, Shannon, Pam, would love your thoughts.
I can speak to that just from an operations, I guess, lens,
sure.
If you want to jump in. But with our school program sits within public health in the Edmonton zone, and I know it's different across the country, but our staff is really well trained in the positive immunization experience, the commitment to comfort, resources. So when our school team goes out, they really are very intentional about the environment that they set. And so what you'll see is they'll choose a space or work with the school to choose a space that's going to be the best for the clients coming through. They play like kind of calming spa music in the back. I call it spa music, massage music, whatever you want to call it, but it really does set the tone. They control the number of kids who are coming in, they control the flow, they have distraction kits. And the minute that client sits down, it's the same approach as, how are you today? Tell me what I can do to make this easier for you. How are you feeling about this? Do you want to look away? Do you want to put music on? Do you want to put your headphones on? I won't surprise you. I'll just touch your arm when I'm ready. So they really have that honest conversation with the kiddo ahead of time. And if they're not able to do it that day, that's okay too. Then we look at the option of partnering with mom and dad to come into the clinic setting. For some kiddos, that's all they need. They just need to come into a private clinic space. And that's perfectly acceptable. And so we'll set that up with the parent. And for some of our kids, once we've had that conversation with the parent, we realize this is a bit more than just needing clinic. We actually might need the low stim. They just may need some additional pieces there. And so then we'll put in a referral to the low stim clinic and we'll see them through that setting. So that's part of why we expanded the vaccines that we offer at the low stim clinic from being that initial mandate of COVID-19 to actually all publicly funded vaccines, so that we're not creating barriers to access. So we really do try to support those kids and the families, but it's understanding through that conversation, what do you need? And then what is the most appropriate environment to support you and normalize it? And some of our students do, just like Pam indicated with Gavin and Morgan, attend the low stim clinic for COVID-19, but were so successful that they were actually able to receive it in a school-based program, which really normalizes the vaccine experience with their peers. And so that was such a win that we built capacity over time for them to be able to do that when it came time for those school immunizations. So that's some of the work that we've done with our team in terms of the school-based program. But Shannon or Pam, if you guys want to add an additional piece, I'd love to hear it.
Yeah, just speaking as a mom and a nurse who has worked in these school clinics, a lot of the nurses that we have that work in the low stim clinic also go out and do school-based immunization program. And I often think of like even our routine well child clinic appointments and our school-based clinic appointments in the office. I often consider them
not truly low stim because the environment is different, but the approach to every appointment is very, very similar. You know, the first thing almost everybody asks is, what can we do to make this easier? Do you have a plan? You know, that's asked across the board. That's not just a low stim thing. And it's just repeated experiences like that you know, contribute to these, you know, ongoing positive things that can help these kiddos out. And, you know, just playing on what I was going to say before that I forgot. You wouldn't believe the barriers you can take down by just asking how you can help. Because as a nurse, it can be quite overwhelming to have a child come in that immediately goes under the table and or, you know, hides in the bathroom at the school. It's like, what do we do? And it's really so easy. It's just, how can I help you? And it took 8 years for somebody to ask my family that question. And the first time they asked me, it was immediate. I was just like, huh. Well, how much time do you have? But really just asking the one question. It's serious. That's all you need to do for every appointment that you have.
Yeah.
I actually, rather than comment, I wanted to ask a question, if that's okay.
Oh, sure.
Because I am a nurse. I know what nurses are like, and we tend to do what we've done all our careers. And I'm wondering, how do you sort of get the word out? How do you get the message? How do you get people on board with this approach? Because, you know, we're like, I've been doing this for 20 years and it's good enough. How do you get past that it's good enough approach?
Can I add to that, just to bring in one of the other questions that came in through the chat? Nurses and teachers. So that's just something else that's come in kind of in that school-based setting. So if people want to comment on either, both, please feel free.
Yeah, and my background's nursing as well. And so I feel that deeply, Shannon. We're taught in nursing school, change is the one constant. And we're like, yeah, we're up for it. And then we start practicing, we're like, no, don't change anything. I like it. So you're right. It was a little bit difficult to change the conversation. I think the approach we've always taken at our health center is we come at it from a head and a heart. So I can give you the research, and Dr. Anna Tadio's research, and Shannon, your research has been instrumental. And so I can give them all of the best practice scenarios and come at it from a, you know, evidence-based research. You know, Skip has all of this phenomenal information and I can disseminate that to them. But the knowledge translation piece is where we sometimes get into that bit of a hurdle. And I think that's where we come at it from the heart. And so sharing stories like Pam's. So Pam and I work in the same office. Pam has Gavin. My son Sam is 10, almost 11, and he has autism. And so he's been instrumental in designing some of the client pieces of our low stim clinic. So he's very proud that he is on record a consult for AHS for this. So but he really was so great at saying, Mom, this is what I would need, or this is what I would want. And so we share those stories in the office to say, so this is Sam. You've met Sam. You know Sam. And if you see Sam regulated, you would have no idea. But if you see Sam dysregulated, you're going to make assumptions about my child and his behavior. And me as a parent, don't do that. Like, you know the background and the story. And so I think really sharing those stories and coming at it from the heart piece. And then our team comes back after low stim appointments, and they're so good at celebrating those wins and saying, I had this amazing appointment today, and this is what I did, and this is what the kiddo did, and it was so awesome. We also come back on the days where it didn't go well, and we brainstorm with each other to say, what would you have done differently? Did I miss anything? I gave Mom and Dad these resources. Is there anything else I can share with them? But again, when we look at it from that patient story, if you chose to be a nurse as a career, you chose to do it, generally speaking, because you are a kind, compassionate, empathetic human, and we can't lose that. And if we continue to have the conversations, ask the questions, get curious, and get back to the human side of what we do, it's really hard to know a story and know that you can do better and then go, I'm just going to choose not to. So I do think it's having those two pieces of the evidence-based, the research, the head part, but you have to have the heart part too, because they need to understand what's in it for them and how it's going to impact their clients in a really positive way.
I appreciate that, Megan, the real power of partnering with people with lived experience to really bring forward that compassion and humanity aspect of it. And I can see people were asking, I know the link for the Commitment to Comfort resources, which are used across Alberta Health Services, were put into a link. Someone asked, are there things teachers can use? Checking out some of those resources. There's like comfort plans for kids that have been developed and all sorts of things. And certainly looking on the SCIP website, we link to a variety of different things and share some of that as well. Sometimes it's just giving information that helps families know what they can do to prepare, on their own. As well, especially in a school-based setting. Some things can be done in the school-based clinic, which we're talking about, but I think part of that, if you look at the clinical practice guidelines for managing vaccine pain and fear, which for those of you listening have been developed here in Canada, but are actually used internationally, including recommendations by the WHO around vaccines, include an education and information preparatory component for families, immunizers as well, but also for youth and families, so that they don't just get that information at the last minute. So sharing those resources within schools, I think, is great. We just have a couple minutes left. And I think, I guess just the one other question that's in the chat here that maybe we can answer briefly is how do we make this happen? How do we champion this, right? Like, this is like, what the low stimulation clinic, Shannon sharing about some of your work, what's happening in the Edmonton zone. This is, it's great what we're talking about today, but not everyone's going to have access to this right now across the country. So, when there's a focus on let's get as many people immunized as we can, right? And that's kind of the systems level emphasis perhaps over these kind of positive experiences, not to say they don't matter, but the emphasis and judgment of success being on how many people are immunized. What are your recommendations and thoughts about how people listening across the country might be able to move forward or champion some of this approach in their own spaces? Just any, again, it's a big question, but any kind of quick tips or thoughts or key takeaways as we wrap up?
The biggest one that we had to fight with in our office was breaking down barriers with people and changing the mindsets that vaccines are just going to hurt. That's just the way it is. Breaking down those barriers was hard. It took us, with our PI program, I think it took us, 2017. We started in 2017, and it took almost, I think, 2-3 years for anybody to even listen to what we were even talking about. We were pushed away so many times. So breaking down barriers and just don't go away. We just didn't go away, and eventually they had to listen to us because they were really annoyed.
Fair enough.
And maybe I'll just comment briefly about, in the public sphere, I think people have become so anxious about talking about vaccines. And one of the chat questions was about, in a science center, how do you just start talking about vaccines in sort of a non-intense sort of way? And I think that's it, is that we need to normalize that vaccines are part of what we do to protect our health. And yes, it's become heated in a COVID context, but we just have to, the thing that motivates a lot of people is the social norm. So vaccines are the social norm. The vast majority of people got vaccinated. Let's not feel nervous about talking about them because of a small proportion of virally vocal folks. Let's acknowledge that the vast majority of people vaccinate themselves and their children. And so just, talk about your successes. Talk about, oh yeah, we're just come back from getting our flu shot. Like, just talk about it, so it's not sort of like some in the closet conversation that you're scared to have because somebody might attack you. The vast majority of people are not actually going to do that.
Thanks, Shannon. And Megan, last thoughts too, just talking about with limited resource, with, these demands on just getting vaccines done. What advice do you have for others?
I think, the advocacy was huge, what Pam said, but I said it in my presentation, you don't need a big budget and, huge infrastructure. What you need is people who actually have that curiosity and that compassion. It's the small adaptations, right? So leaving a door open does not cost you additional money. Drawing up the vaccines ahead of time at the parent's request does not cost you any money. So it's just shifting the mindset. And if we do it differently, if we do it better, and we start to see parents asking for it and advocating for it, I think we're going to start to move the dial. But I think it's, as a practitioner, really just, if you know better, you do better. And so, you don't need a huge budget. You really just need to make those small adaptations. They actually have really profound impacts for the clients that we serve.
Wonderful. I'll turn it back to Paula, but just one last plug. SKIP is here to support organizations in partnership with Children's Healthcare Canada and others across the country to improve vaccine experiences, other painful procedures, and other painful disease. So please check out the resources we have, kidsinpain.ca, or reach out over our contact on website or social media, and happy to work with you, connect you if you don't reach out directly to any of the individuals on this call, to move forward and champion some of this work where you are also. And thanks to Children's Healthcare Canada for today, and wish everyone also an enjoyable rest of National Kids and Vaccines Day.
Thank you, Shannon, Megan, Pamela, Katie, for an engaging presentation. Before I get to what's coming up on Spark, to help inform our improvements we make to our Spark program, we'd like to ask you a few quick poll questions. A note again, you'll have to answer all 5 questions before submitting your response. And I'll give you a couple of seconds to answer for those of you who are remaining, and then we'll let you know that this is the end of our time together today. So I want to thank Shannon McDonald, Megan McDonald, Pamela Nagy, and Katie Burney for sharing your time and expertise with us. And thanks to our audience members for joining in on this Kids and Vaccines Day. We know how busy you all are, and we hope you depart with some practical knowledge to bring back to your organization. As part of Kids and Vaccines Day, join us, Science Up First, SKIP, and other participating organizations on Twitter or Facebook to share and reshare the hashtag Kids Vaccines Day. And tonight at 8 p.m., join us in the town hall, during which experts will take questions from parents and other Canadians on the importance, safety, and effectiveness of routine childhood vaccines and catching up on any missed doses during COVID. The registration link for the town hall is now going to be posted in the chat. Upcoming still in February, on February 27th, we'll release the next Spark Conversations edition, Child Health Research, Thinking Out of the Typical Healthcare System Box, featuring our guest, Dr. Jason Berman from CHIO's Research Institute, in conversation with our host, Dr. Catherine Smart. March is Child Health in the Media theme month here at Spark. Upcoming, we have 2 webinars. One is still in the planning stages, so stay tuned for more information. And on March 15th at 11 a.m. Eastern, we have a webinar with special guest speaker David Alexander, who's the president at Leading for Kids, about their work with the Frameworks Institute and how to keep children on the radar. And on March 27th, we'll release the next podcast episode on child health in the media with our special guest, Carly Weeks. Thanks again for joining us today. Thanks to Shannon, Megan, Pamela, and Katie for their presentation. And hopefully we'll see many of you back here next month. Bye, everyone.